Hello everybody, this is my name is Mark Piper. I work for Pompano Beach Fire Rescue and I work on the rescue mainly. While we're on the truck, we run medical calls and we use our Airway bag more often than not. Our Airway bag we bring on every call and we check it out every morning before shift. Anything we use on a call we replace once we're done with it at the end of the shift. But I'm going to show you how we check out our Airway bag. So the first thing is we always wear gloves because the Airway bag is a canvas material and we're not able to clean it as well as we like to most times, so we always wear gloves when we check out our truck. So the first thing I do as I open it up is I pull out our roll, and this is for intubation. So inside our Airway bag we have our laryngoscope. And laryngoscope blades. And as you see, the bag's already somewhat ripped. This is a sterile bag, but it's somewhat ripped, so we can check it out. And we connect it, and we see if the light turns on, which you can see the light is on. And we will go through and we'll check our blades to make sure the batteries in the handle are good, and also that the bulbs in the laryngoscope blades are good. So we have Miller blades and we have Mac blades over here. And we check them all out. Just to make sure everything is working before we get a call where we need it. And the light is working here. We also have our ET tubes, endotracheal tubes. We have an assortment of tubes. They range from a size 2.5 to a size 9.5. So we have the variations, everything in between. The larger sizes come with a stylet. For the ET tubes, we have a 10cc syringe. We have an inline filter. And we also have OPAs. This will be our first airway adjunct. We have what we call the endo locks. These, once you've intubated your patient, you use the endo lock to secure the endotracheal tube to the patient. We have one for adults and one for children. And then we also have the rescue pod. This is the device that we use when we're ventilating the patient with the ET tube. You put this on in between the ET tube, and you put the bag valve mask on the back of that, and you bag them for as long as they're not breathing. As soon as they start to regain pulses, you take this off and just bag them directly to the ET tube. We also have here some forceps. Some large ones and some smaller in diameter size. We also have some loose, this is non-rebreathers, so we have some loose non-rebreathers and end-tidal CO tubes. We have a stethoscope. Because this is our Airway bag, most of our patients we want to listen to lung sounds before, just to help diagnose the patient. In here we have an assortment of nasopharyngeals. You see we have a wide variety for the different sizes of people. This is our care vent. We no longer use this. We still have it on our truck, but we no longer use it. This, you hook up to the oxygen cylinder, and it allows you to breathe for the patient while you're doing CPR. So it's more of a hands-free device. And this is our track light, our air track, and this assists us with intubation. If you have a tough intubation where you're not able to, you have a hard time intubating with just the laryngoscope, this magnifies the airway and it gives you, it's just another tool to assist you in intubating a patient that's not breathing or having trouble breathing. So we also have inside our Airway bag, non-rebreathers. This is an adult, we have a child, and we have a pediatric non-rebreather mask. On this side of the Airway bag, we have our CPAPs. We have a large adult, a medium adult, sorry, a small adult, and a child CPAPs. These are for our CHF patients. We keep one of each inside the bag, and when we use it, we replace it. And inside this final pocket here, we have our nebulizers. And this, we have two. We normally set it up so we have actually a treatment already in the bag, so if you need it in a hurry, you just pull it out and everything you need is in one bag. When we're done, we zip everything up and we make sure our bag's ready to go, and that's how we check out our Airway bag.